In the arena of treating diabetic macular edema, DME, two heavyweight contenders, Avastin and Lucentis, take center stage. Both drugs have proven efficacy in managing DME, but their differences have sparked a debate among medical professionals and patients alike. This video dives into the ring, breaking down the similarities, dissimilarities, and controversies surrounding Avastin and Lucentis. Avastin, originally approved to treat cancer, has gained popularity as an off-label treatment for DME. With its lower cost compared to Lucentis, Avastin has garnered attention for its cost-effectiveness, making it a favorable option for some patients and healthcare providers. On the other hand, Lucentis was specifically developed for DME, offering a targeted approach to treating the condition. Despite its higher price tag, Lucentis boasts extensive clinical studies and widespread approval, positioning it as a trusted choice for many. Join us as we explore the clinical evidence, potential side effects, cost considerations, and patient experiences tied to both Avastin and Lucentis. By the end, you'll have a well-rounded understanding of these fierce contenders and be equipped to make an informed decision on the best treatment option for DME. Understanding Avastin and Lucentis. Avastin, bevacizumab, and Lucentis, ranibizumab, are both anti-vascular endothelial growth factor, anti-VEGF, medications used in the treatment of diabetic macular edema. Avastin, developed by Genentech, was initially approved by the U.S. Food and Drug Administration, FDA, for the treatment of various cancers. However, due to its anti-VEGF properties, it has found success as an off-label treatment for DME. Lucentis, also developed by Genentech, was specifically designed to target DME and received FDA approval for this indication. Both Avastin and Lucentis work by inhibiting the effects of VEGF, a protein that promotes the growth of abnormal blood vessels in the retina, leading to fluid leakage and retinal swelling in DME patients. By blocking VEGF, these medications aim to reduce edema and improve visual acuity. While Avastin and Lucentis have a similar mechanism of action, there are notable differences in their formulation, dosage, and administration. Avastin is a full-length antibody, while Lucentis is a smaller fragment of the same antibody. Additionally, Avastin is administered as an intravenous infusion, while Lucentis is injected directly into the eye. Efficacy and safety of Avastin in treating DME. Avastin has gained significant attention as an off-label treatment for DME due to its lower cost compared to Lucentis. Several clinical trials and real-world studies have demonstrated the efficacy of Avastin in improving visual acuity and reducing retinal thickness in DME patients. One such study, the Comparison of Age-Related Macular Degeneration Treatments Trials, CAT, compared the effectiveness of Avastin and Lucentis in treating not only age-related macular degeneration but also DME. The results showed that Avastin and Lucentis had similar visual acuity outcomes, suggesting that Avastin could be a viable alternative for DME treatment. In terms of safety, Avastin has been generally well tolerated in DME patients. However, there have been concerns regarding potential systemic side effects, as Avastin is primarily formulated for intravenous use in cancer treatment. These concerns include an increased risk of stroke, myocardial infarction, and gastrointestinal bleeding. Nevertheless, the incidence of these adverse events in DME patients receiving Avastin remains relatively low. Efficacy and safety of Lucentis in treating DME. Lucentis, specifically developed for the treatment of DME, has undergone extensive clinical trials to establish its efficacy and safety. The pivotal RISE and RIDE trials demonstrated that Lucentis significantly improved visual acuity and reduced retinal thickness in DME patients compared to a placebo. Furthermore, Lucentis has gained widespread approval from regulatory bodies worldwide, including the FDA and the European Medicines Agency, EMA. Its targeted approach to treating DME and the wealth of clinical evidence supporting its efficacy have made Lucentis a trusted choice for many healthcare providers. In terms of safety, Lucentis has a favorable profile, with most adverse events being related to the injection procedure itself rather than the medication. Common side effects include eye pain, increased intraocular pressure, and conjunctival hemorrhage. These side effects are typically transient and manageable with proper monitoring and care. Cost comparison of Avastin and Lucentis. One of the key considerations when choosing between Avastin and Lucentis is the significant difference in cost. Avastin, as an off-label treatment, is significantly cheaper than Lucentis. The lower cost of Avastin has been attributed to its availability as a cancer drug and the larger volume of Avastin required for intravenous administration compared to Lucentis injections. For patients without insurance coverage or with limited financial resources, Avastin may be the more accessible option. However, it's important to note that insurance coverage and reimbursement policies vary, and some healthcare providers may have restrictions or preferences regarding the use of off-label medications like Avastin. Lucentis, on the other hand, has a higher price tag, but the targeted approach and extensive clinical studies supporting its use may provide reassurance for patients and healthcare providers. Additionally, Lucentis is often covered by insurance for the treatment of DME, making it a more viable option for many individuals. Side effects and risks of Avastin and Lucentis. As with any medication, both Avastin and Lucentis carry potential side effects and risks. Avastin, being an off-label treatment for DME, has raised concerns about potential systemic side effects. While rare, there have been reports of serious adverse events such as stroke, myocardial infarction, and gastrointestinal bleeding in patients receiving Avastin for DME. However, it's important to note that the incidence of these events remains low in clinical practice. Lucentis, specifically developed for DME, has a generally favorable safety profile. Most side effects are related to the injection procedure itself, including eye pain, increased intraocular pressure, and conjunctival hemorrhage. These side effects are typically mild and transient, resolving without long-term consequences. It's crucial for patients to be monitored regularly by their healthcare provider to ensure early detection and management of any potential complications. Choosing the right treatment option for DME. When it comes to choosing between Avastin and Lucentis for the treatment of DME, several factors need to be considered. Efficacy, safety, cost, and individual patient characteristics all play a role in making an informed decision. For patients with limited financial resources or those without insurance coverage, Avastin may be a more affordable option. It has demonstrated efficacy in improving visual acuity and reducing retinal thickness in DME patients and is generally well tolerated. On the other hand, Lucentis, with its targeted approach and extensive clinical evidence, may provide a sense of security and confidence for patients and healthcare providers. While it has a higher cost, insurance coverage and reimbursement policies often make Lucentis accessible for DME treatment. Ultimately, the decision should be made in consultation with a healthcare provider who can assess the individual patient's needs, preferences, and financial situation. Patient experiences and success stories with Avastin and Lucentis. The experiences of DME patients who have received treatment with Avastin or Lucentis can provide valuable insights. Many patients have reported improved visual acuity and quality of life after receiving these medications. Some patients who have chosen Avastin appreciate the lower cost and comparable efficacy to Lucentis. They have experienced positive outcomes and have been able to manage their DME effectively without significant financial burden. On the other hand, patients who have opted for Lucentis often value the reassurance of a medication specifically developed for DME and backed by extensive clinical studies. They have also reported positive outcomes and appreciate the convenience of regular eye injections. It's important to note that individual experiences may vary, and what works for one patient may not work for another. Consulting with a healthcare provider and considering personal circumstances can help guide the decision-making process. Future developments in DME treatment. The field of DME treatment continues to evolve, with ongoing research and development aiming to improve outcomes and expand treatment options. Several new medications and treatment modalities are being investigated, including longer-lasting anti-VEGF agents, sustained-release drug delivery systems, and gene therapy. These future developments hold promise for potentially reducing treatment burden, improving efficacy, and addressing specific patient needs. As the understanding of DME and its underlying mechanisms expands, healthcare providers will have more tools at their disposal to tailor treatment to individual patients. Conclusion: making an informed decision about Avastin and Lucentis. Avastin and Lucentis have emerged as two prominent contenders in the treatment of diabetic macular edema. While both medications have shown efficacy in improving visual acuity and reducing retinal thickness, they differ in terms of cost, formulation, and approved indications. Avastin, as an off-label treatment, offers a more affordable option, but concerns remain regarding potential systemic side effects. Lucentis, specifically developed for DME, provides a targeted approach and extensive clinical evidence, albeit at a higher cost. When choosing between Avastin and Lucentis, it's crucial to consider individual patient characteristics, preferences, and financial circumstances. Consulting with a healthcare provider can help navigate the decision-making process and ensure the best possible outcome for DME treatment. As the field of DME treatment continues to advance, future developments hold promise for improving outcomes and expanding treatment options. With ongoing research and innovation, healthcare providers will have an increasingly diverse toolbox to address the needs of patients with DME.